Let's be honest. Most men, at some point in their life, have wondered, is my penis size normal? And for men over 50, that question can come back with even more intensity. Today, we're cutting through the myths, the locker room exaggerations, and the internet noise to talk honestly about penis size, aging, and what actually matters. Hi, I'm Zoe Hartley, and I've spent years helping men navigate health questions that are too often brushed under the rug. This isn't about ego or performance pressure. It's about understanding your body and feeling confident in it, especially as it changes with age. If you're a young boy or old man, this video is for you. So, let's get into the numbers. According to one of the most cited medical reviews, which looked at over 15,000 men across the globe, the average erect penis is around 5.1 to 5.5 inches long. Flaccid, it's about 3.5 to 4 inches. And the average circumference? Roughly 4.6 inches erect. Here's what's key. 90% of men fall within 1 inch of the average. So if you're somewhere between 4 to 6 inches, you're squarely in the normal range. Now, let's talk about aging. As men get older, a few natural things can happen. Lower testosterone levels can reduce blood flow, which may lead to a slightly smaller or softer appearance. Weight gain, especially around the abdomen, can make the penis look shorter, even if it hasn't changed at all. Erectile function may change, but that doesn't mean your penis is shrinking. These are normal, biological shifts, not signs of failure or inadequacy. Here's the truth that almost no one talks about. Size rarely affects satisfaction in you or your partner. Most men overestimate what big means and underestimate what women or partners actually care about. Studies consistently show that. Number 1, emotional connection. Number 2, confidence. Number 3, communication. And yes, technique matter far more than length. And guess what? When men stop comparing and start focusing on health, connection, and self-respect, confidence grows naturally. Let's also clear out some of the myths. Pills, pumps, or creams that promise permanent growth. No clinical evidence supports them. Penis enlargement surgeries? Risky, expensive, and often result in dissatisfaction or complications. These products prey on insecurity, especially in older men, but they don't deliver lasting results. You deserve better than snake oil. Instead of obsessing over size, here's what you should focus on. Keeping testosterone levels balanced through sleep, exercise, diet. Managing weight and blood pressure. Staying sexually active, even solo, to maintain healthy function. Talking openly with your doctor or urologist if anything feels off. Because a healthy penis isn't just about sex, it's a sign of overall vascular and hormonal health. So, is your penis size normal? Chances are, yes. Absolutely. Aging doesn't make you less of a man. If anything, it gives you wisdom, perspective, and maybe even better sex than when you were younger, if you let go of the myths and take care of your health. If you found this video helpful, hit the like button. Subscribe for more real, shame-free men's health advice, because no one else is having these conversations the way we should be. Check out the next video where we talk about the "Can I make my penis bigger?" and what to do about them.